Let's begin. Question 1. A 6-month-old is being introduced to solids. Which food is best to offer first? A. Honey. B. Mashed banana. C. Cow's milk. D. Whole grapes. Correct answer, B. Mashed banana. Rationale: soft, single ingredient, low allergen, safe texture. Strategy: introduce one single food at a time, avoid choking hazards and honey less than 1 year. Question 2. Which toy is safe for a 9-month-old infant? A. Small beads. B. Teething ring. C. Marbles. D. Button battery toy. Correct answer, B. Teething ring. Rationale: large, non-breakable, appropriate mouthing. Strategy: choose toys larger than mouth/choking size, avoid batteries. Question 3. An infant presents with nasal flaring and intercostal retractions. Priority nursing action. A. Offer oral fluids. B. Place in high Fowlers. C. Assess respiratory rate/oxygenation. D. Give antipyretic. Correct answer, C. Assess respiratory rate/oxygenation. Rationale: signs indicate increased work of breathing, assess oxygenation first. Strategy: airway/respiratory assessment first in pediatric distress. Question 4. A toddler with suspected otitis media pulls at the ear and has a fever. Most likely cause: A. Otitis externa. B. Otitis media. C. Throat infection. D. Foreign body. Correct answer, B. Otitis media. Rationale: ear pulling plus fever typical of middle ear infection. Strategy: correlate ear symptoms with fever and examine tympanic membrane. Question 5. Which vaccine is contraindicatd in a severely immunocompromised child? A. Inactivated influenza. B. MMR, live. C. Hepatitis A. D. DTaP. Correct answer, B. MMR, live. Rationale: live vaccines can cause disease in severe immunosuppression. Strategy: check immune status before administering live vaccines. Question 6. A child with a croup has a barking cough and stridor at rest. Immediate nursing step. A. Give oral antibiotic. B. Provide cool humidified air/steam. C. Start 4 fluids. D. Obtain throat culture. Correct answer, B. Provide cool humidified air/steam. Rationale: humidity and cool air reduce upper airway swelling and distress. Strategy: non-invasive measures first for mild/moderate upper airway edema. Question 7. Infant with sunken fontanelle, dry mucous membranes, best indicator of: A. Overhydration. B. Dehydration. C. Normal newborn. D. Intracranial pressure. Correct answer, B. Dehydration. Rationale: sunken fontanelle is a classic sign of fluid volume deficit. Strategy: use weight and INO plus physical signs to assess hydration. Question 8. Which feeding instruction for a baby with cleft palate post-op? A. Place on abdomen to feed. B. Use bulb syringe only. C. Use special feeding device, upright positioning. D. Begin solid foods immediately. Correct answer, C. Use special feeding device, upright positioning. Rationale: upright reduces aspiration risk, special nipples control flow. Strategy: protect surgical repair and airway when feeding. Question 9. A child with suspected epiglottitis is drooling, sitting forward, and refuses to lie down. Nurse should: A. Inspect throat with tongue depressor. B. Keep child calm and prepare for airway support. C. Encourage oral fluids. D. Obtain throat culture. Correct answer, B. Keep child calm and prepare for airway support. Rationale: agitation can precipitate airway obstruction, inspection may worsen. Strategy: airway stabilization, avoid procedures that provoke laryngospasm. Question 10. A 2-year-old has sudden severe abdominal pain and drawing up legs. Most concerning sign: A. Passing gas. B. Bilious vomiting. C. Normal urine output. D. Soft abdomen. Correct answer, B. Bilious vomiting. Rationale: bilious vomiting in a child suggests intestinal obstruction. Strategy: suspect surgical abdomen with bilious emesis, escalate. Question 11. Best site for IM vaccine in a 6-month-old. A. Deltoid. B. Vastus lateralis, anterolateral thigh. C. Gluteal. D. Abdomen. Correct answer, B. Vastus lateralis. Rationale: thigh has adequate muscle mass in infants. Strategy: use recommended infant IM sites to ensure proper absorption. Question 12. A child with asthma uses accessory muscles and speaks in single words. Next action. A. Administer nebulized albuterol immediately. B. Give oral antihistamine. C. Observe for 30 minutes. D. Offer a snack. Correct answer, A. Administer nebulized albuterol immediately. Rationale: signs of severe exacerbation, bronchodilator first. Strategy: treat airway obstruction promptly with inhaled beta agonists. Question 13. Which sign is the earliest indicator of hypoxia in children? A. Cyanosis. B. Restlessness/irritability. C. Bradycardia. D. Hypotension. Correct answer, B. Restlessness/irritability. Rationale: behavioral changes precede vital sign deterioration. Strategy: act on early neuro changes to prevent progression. Question 14. A neonate has a positive Babinski reflex. This is A. Normal finding. B. Pathologic after 2 months. C. Sign of CP immediately. D. Requires immediate CT. Correct answer, A. Normal finding. Rationale: plantar reflex dorsiflexion is normal in infants. Strategy: no age-appropriate reflex timelines. Question 15. A child with suspected intussusception has current jelly stools. This suggests A. Viral gastroenteritis. B. Hemorrhagic colitis. C. Intussusception with bowel ischemia. D. Constipation. Correct answer, C. Intussusception with bowel ischemia. Rationale: bloody mucoid stools indicate bowel compromise. Strategy: urgent surgical/gastroenterology evaluation. Question 16. A 4-year-old with fever and petechiae, immediate priority. A. Antipyretic administration. B. Obtain blood cultures and start antibiotics. C. Give oral fluids. D. Observe at home. Correct answer, B. Obtain blood cultures and start antibiotics. Rationale: fever plus petechiae may indicate sepsis/meningococcemia. Strategy: treat potential sepsis aggressively. Question 17. Best measure to prevent SIDS in infants. A. Prone sleeping. B. Co-sleeping with parent. C. Back to sleep on firm surface, no loose bedding. D. Soft mattress and pillows. Correct answer, C. Back to sleep on firm surface, no loose bedding. Rationale: supine sleep reduces SIDS risk, removes suffocation hazards. Strategy: educate caregivers on safe sleep practices. Question 18. For dehydration, most accurate clinical indicator in infants. A. Capillary refill only. B. Daily weight changes. C. Mucous membranes only. D. Pulse rate only. Correct answer, B. Daily weight changes. Rationale: weight loss/gain provides quantitative fluid status. Strategy: use weights plus INO plus physical signs for fluid assessment. Question 19. A child ingests an unknown pill, the parent calls the nurse. First step. A. Induce emesis at home. B. Call poison control/poison hotline. C. Give activated charcoal immediately. D. Ignore unless symptoms appear. Correct answer, B. Call poison control/poison hotline. Rationale: poison control provides agent-specific guidance. Strategy: Don't induce vomiting unless directed by experts. Question 20. A newborn's heart rate is 90 bpm in delivery room and limp, immediate action. A. Observe and recheck in 10 minutes. B. Begin neonatal resuscitation, positive pressure ventilation. C. Provide supplemental oxygen only. D. Allow skin-to-skin contact. Correct answer, B. Begin neonatal resuscitation, PPV. Rationale, HR less than 100 with poor tone requires ventilation per NRP. Strategy, follow neonatal resuscitation program algorithms. Question 21. A child with type 1 diabetes has rapid shallow breathing and abdominal pain. Lab likely. A. Hypoglycemia. B. Diabetic ketoacidosis, DKA. C. Hyperosmolar hyperglycemic state. D. Normal glucose. Correct answer, B. DKA. Rationale, Kussmaul respirations, abdominal pain suggest ketoacidosis. Strategy, check glucose, electrolytes, begin fluid and insulin protocol. Question 22. Which is the best intervention for bronchiolitis, RSV, in infants? A. Routine bronchodilators for all infants. B. Supportive care, humidified oxygen, hydration, suctioning PRN. C. Early antibiotics. D. Corticosteroids for all. Correct answer, B. Supportive care, humidified oxygen, hydration, suctioning PRN. Rationale, RSV management is mainly supportive, antibiotics only for secondary infection. Strategy, treat symptoms and maintain airway/hydration. Question 23. A 3-year-old is nonverbal and avoids eye contact, which is concerning for A. Typical development. B. Autism spectrum disorder, ASD, screening recommended. C. Language delay only. D. ADHD. Correct answer, B. Autism spectrum disorder, ASD, screening recommended. Rationale, social communication deficits warrant ASD evaluation. Strategy, refer for developmental screening and early intervention. Question 24. Child with sickle cell crisis has severe pain, priority nursing action. A. Provide 4 opioids and hydration. B. Give iron supplement. C. Restrict fluids. D. Place in Trendelenburg. Correct answer, A. Provide 4 opioids and hydration. Rationale, pain control and hydration reduce sickling and complications. Strategy, treat pain aggressively and maintain perfusion. Question 25. Which is a red flag for child abuse? A. Single fracture from high-impact trauma. B. Symmetric bruises on shins in toddler who ambulates. C. Burns with clear stocking/glove pattern. D. Isolated minor abrasion on forehead. Correct answer, C. Burns with clear stocking/glove pattern. Rationale, patterned burns often suggest inflicted injury. Strategy, report and investigate suspected abuse per protocol. Question 26. Best feeding recommendation for an infant with cleft lip, pre-op. A. Breastfeed only without assistance. B. Upright positioning with special nipple and paste feeding. C. Offer solids early. D. Feed while supine. Correct answer, B. Upright positioning with special nipple and paste feeding. Rationale, reduces aspiration and improves intake. Strategy, use feeding adaptations to ensure adequate nutrition. Question 27. A toddler chokes but can cough and cry. Nurse should A. Perform abdominal thrusts immediately. B. Encourage forceful coughing and monitor. C. Begin CPR. D. Give water to drink. Correct answer, B. Encourage forceful coughing and monitor. Rationale, if the airway is partially patent, allow spontaneous expulsion. Strategy, intervene only if unable to cough/cry or become cyanotic. Question 28. Child with Kawasaki disease, highest concern is A. Conjunctivitis only. B. Development of coronary artery aneurysms. C. Rash on cheeks only. D. Mild fever for 1 day. Correct answer, B. Development of coronary artery aneurysms. Rationale: cardiac complications are the major risk. Strategy: administer IVIG and aspirin per protocol, monitor cardiac status. Question 29. A 7-year-old with suspected appendicitis has RLQ pain, fever, and guarding. Next step. A. Prepare for immediate discharge with analgesic. B. NPO and surgical consult for appendectomy evaluation. C. Give laxative. D. Begin home observation. Correct answer: B. NPO and surgical consult for appendectomy evaluation. Rationale: classic signs require surgical evaluation and imaging. Strategy: NPO and prep for possible surgery when appendicitis is suspected. Question 30. A 10-month-old with stridor and high fever needs: A. Immediate throat inspection with tongue depressor. B. Secure airway and obtain airway team, possible epiglottitis. C. Routine throat culture. D. Oral antibiotic at home. Correct answer: B. Secure airway and obtain airway team, possible epiglottitis. Rationale: high fever, stridor, toxic appearance may indicate epiglottitis, inspection can precipitate obstruction. Strategy: airway first, call ENT/anesthesia/surgery early. Question 31. Which sign suggests increased intracranial pressure in an infant? A. Sunset eyes and bulging fontanelle. B. Active sucking. C. Frequent smiles. D. Rapid weight gain. Correct answer: A. Sunset eyes and bulging fontanelle. Rationale: bulging fontanelle and setting sun sign indicate ICP. Strategy: monitor neurostatus and notify providers promptly. Question 32. Child on methotrexate for juvenile idiopathic arthritis, key teaching. A. Methotrexate causes no lab abnormalities. B. Avoid pregnancy and use contraception, monitor liver function and CBC. C. No need for folic acid. D. Stop vaccines permanently. Correct answer: B. Avoid pregnancy and use contraception, monitor liver function and CBC. Rationale: methotrexate is teratogenic and hepatotoxic, requires monitoring. Strategy: educate on meds risks and routine labs. Question 33. Which is expected in a 2-year-old developmentally? A. Runs and walks upstairs independently. B. Uses full sentences with complex grammar. C. Writes full name. D. Skips on one foot. Correct answer: A. Runs and walks upstairs independently. Rationale: gross motor skills like running and stair climbing appear around age 2. Strategy: assess age-appropriate milestones using developmental screening tools. Question 34. A child has watery diarrhea and severe vomiting. Which acid-base disturbance is most likely? A. Metabolic alkalosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Respiratory acidosis. Correct answer: B. Metabolic acidosis. Rationale: loss of bicarbonate and dehydration can lead to acidosis. Strategy: monitor electrolytes and provide rehydration with appropriate fluids. Question 35. Which medication is indicated for status asthmaticus in children once initial bronchodilator fails? A. Inhaled cromolyn only. B. For magnesium sulfate as adjunct. C. Oral montelukast only. D. No further treatment. Correct answer: B. For magnesium sulfate as adjunct. Rationale: magnesium relaxes bronchial smooth muscle in severe cases. Strategy: escalate therapy per severe asthma protocols. Question 36. A newborn with meconium-stained fluid is floppy and not breathing at birth. Nurse should: A. Suction vigorously with bulb syringe only. B. Begin positive pressure ventilation and follow NRP, do not stimulate suction blindly. C. Place on mother's chest immediately. D. Observe for spontaneous breathing only. Correct answer: B. Begin positive pressure ventilation and follow NRP, do not stimulate suction blindly. Rationale: depressed newborn needs ventilation, meconium management per NRP. Strategy, follow resuscitation guidelines for depressed neonates. Question 37. Child with suspected meningitis, most important immediate nursing action. A. Start broad-spectrum antibiotics after blood cultures. B. Obtain throat swab only. C. Give oral analgesic and send home. D. Encourage fluids and observe. Correct answer, A. Start broad-spectrum antibiotics after blood cultures. Rationale, early antibiotic therapy reduces morbidity/mortality, obtain cultures first if possible. Strategy, prioritize blood cultures then immediate empiric antibiotics. Question 38. A toddler with lead poisoning will most likely show which lab finding? A. Low blood lead level. B. Elevated blood lead level and microcytic anemia. C. High WBC count only. D. Hypercalcemia. Correct answer, B. Elevated blood lead level and microcytic anemia. Rationale, lead interferes with heme synthesis causing anemia. Strategy, screen at-risk children and initiate chelation therapy if indicated. Question 39. Which is an appropriate pain assessment for a 2-year-old? A. Ask to rate pain 0 to 10 numerically. B. Use FLAC, face, legs, activity, cry, consolability, observational tool. C. Assume no pain if sleeping. D. Use adult visual analog scale only. Correct answer, B. Use FLAC observational tool. Rationale, young children may not verbalize pain, use behavioral scales. Strategy, use age-appropriate pain assessment tools. Question 40. A 5-year-old with febrile seizure stops seizing after 2 minutes. Next action. A. Discharge home immediately without observation. B. Assess airway, breathing, circulation, and observe, investigate fever source. C. Start long-term anticonvulsant therapy immediately. D. Induce hypothermia. Correct answer, B. Assess airway, breathing, circulation, and observe, investigate fever source. Rationale, postictal assessment and monitoring are required, treat underlying fever. Strategy, manage airway and identify cause, refer if recurrent. Question 41. Best way to prevent varicella in community. A. Encourage bed rest only. B. Varicella vaccination per schedule. C. Prophylactic antibiotics to all children. D. Avoid all outdoor play. Correct answer, B. Varicella vaccination per schedule. Rationale, vaccination prevents disease and complications. Strategy, promote immunization per CDC schedule. Question 42. A child with cystic fibrosis has bulky foul-smelling stools. Best nursing teaching. A. Reduce fat intake drastically. B. Administer pancreatic enzymes with meals and snacks. C. Avoid all dairy permanently. D. Restrict fluids. Correct answer, B. Administer pancreatic enzymes with meals and snacks. Rationale, CF causes pancreatic insufficiency, enzymes aid digestion. Strategy, ensure adherence to enzyme regimen for adequate nutrition. Question 43. A 4-year-old post-op tonsillectomy begins frequent swallowing and tachycardia. Nurse suspects. A. Hunger. B. Bleeding, hemorrhage. C. Normal recovery. D. Dehydration only. Correct answer, B. Bleeding, hemorrhage. Rationale, frequent swallowing is an early sign of oropharyngeal bleeding. Strategy, assess throat, notify surgeon, prepare for interventions. Question 44. Which developmental play is typical for a preschooler, for years? A. Cooperative imaginative play with peers. B. Parallel play only. C. Solitary play all the time. D. Organized competitive team sports. Correct answer, A. Cooperative imaginative play with peers. Rationale, preschoolers engage in fantasy and social play. Strategy, use play to assess social and cognitive development. Question 45. An infant with suspected pyloric stenosis has projectile vomiting and palpable olive mass. Priority action. A. Place on 4 fluids to correct dehydration and electrolytes. B. Give oral feedings immediately. C. Start antibiotics. D. Discharge home with antacid. Correct answer, A. Place on 4 fluids to correct dehydration and electrolytes. Rationale, fluid and electrolyte resuscitation needed prior to surgery. Strategy, stabilize medically before surgical correction. Question 46. A child with hemophilia presents with joint swelling and pain. Best immediate treatment. A. Apply heat only. B. Rice plus factor replacement, replace missing clotting factor. C. Give aspirin. D. Encourage strenuous exercise. Correct answer, B. Rice plus factor replacement, replace missing clotting factor. Rationale, replace deficient factors to stop bleeding, rice reduces swelling. Strategy, avoid NSAIDs/aspirin, use factor therapy per protocol. Question 47. Which sign in a neonate is an emergency requiring immediate intervention? A. Acrocyanosis in hands/feet only. B. Grunting with nasal flaring and RR greater than 60. C. Brief irregular respirations without distress. D. Moro reflex present. Correct answer, B. Grunting with nasal flaring and RR greater than 60. Rationale, indicates respiratory distress, may need oxygen or ventilation. Strategy, assess and intervene early for respiratory compromise. Question 48. A 3-year-old presents with a barking cough at night that improves with exposure to cool air. Diagnosis. A. Epiglottitis. B. Croup, laryngotracheobronchitis. C. Foreign body aspiration. D. Bronchiolitis. Correct answer, B. Croup, laryngotracheobronchitis. Rationale, classic nighttime barking cough and improvement with cool air. Strategy, supportive care and racemic epinephrine/corticosteroids if severe. Question 49. A child is started on digoxin for heart failure. Which parental teaching is priority? A. Give double dose if one missed. B. Check pulse and notify provider if less than 90 in infants or less than 70 in older children. C. Stop all other meds. D. Give with antacids only. Correct answer, B. Check pulse and notify provider if less than 90 in infants or less than 70 in older children. Rationale, bradycardia is an early sign of digoxin toxicity in pediatrics. Strategy, teach pulse checks and toxicity signs, follow dosing instructions precisely. Question 50. A febrile neonate, less than or equal to 28 days, arrives in ED. Best immediate action. A. Send home with antipyretic and follow-up. B. Obtain blood, urine, and CSF cultures and start empiric 4 antibiotics after cultures. C. Observe for 24 hours only. D. Give oral antibiotics only. Correct answer, B. Obtain blood, urine, and CSF cultures and start empiric 4 antibiotics after cultures. Rationale, neonates are at high risk for serious bacterial infection, prompt workup and empiric therapy indicated. Strategy, treat febrile neonates as potentially septic until proven otherwise. Thanks for watching NCLEX Made Easy 91. If you found this helpful, don't forget to like, comment, and subscribe for more high-quality medical NCLEX questions. See you in the next video. Keep mastering success.